All right, a very warm welcome everyone to this very exciting webinar on pandemic statistics. Let me just say first off, I am super excited. This has been on my wish list since late 2021. So finally getting all of you guys together is super thrilling. I am really happy to get this started. For those of you who don't know me, I am Mattias Strandberg. I am the Swedish secretary for the Swedish Statistical Society, who's organizing this webinar. We also host a number of other webinars and activities throughout the year. So please check out our website, www.statistikfrämjandet.se, if you want to know more about us and what we do. Today, we are going to talk about the pandemic, which is hopefully way behind us by now. Just last week, President Biden declared that COVID pandemic is over in the US, at least. And as far as I know, most countries have also decided that we are clear. But let's talk about what we actually learned from the pandemic with regards to statistics. I'm not an expert on this, and that's why I've gathered a number of awesome people. We have from Sweden, Lisa Brouwers, who is the head of the unit for analysis at the Public Health Administration in Sweden. She holds a PhD in computer and system sciences and has an interest in simulation and modeling. A warm welcome, Lisa.
Thank you.
From Norway, we have Anders Sønstebø. He is a sociologist and has worked at Statistisk Centralbyrå in Norway since 2006. Before that, he was on a national research foundation. He's been involved in population statistics since 2017 and is, among others, responsible for Norway's death statistics, meaning he had a lot to do during the pandemic. A warm welcome, Anders. From Finland, we have Pauliina Ilmonen. She is a statistics professor at Aalto University School of Science in Finland. Her research interests include functional data analysis, extreme value theory, invariant coordinate selection, epidemiology of viruses, and also cancer genetics and cancer epidemiology. During the pandemic, she participated actively in the public discussion about the pandemic, and was also a member of the Inter-Academy Partnership COVID-19 Expert Group. A warm welcome, Pauliina.
Thank you.
And last but certainly not least, Lasse Engbo Christiansen from Denmark. He is a senior researcher, and since 2022, he heads a newly established modeling group at Statens Serum Institut in Denmark. This after he in March 2020, just as the pandemic hit, formed a new modeling group to support the SSI through the pandemic. His main research interests are in combining modeling of stochastic and deterministic dynamical systems with a range of questions within infection epidemiology. Wow, that's a mouthful. Warm welcome, Lasse.
Thank you.
As I said, I'm thrilled to have you here. I think let's just get started. First question off is, what has been the greatest takeaway or learnings that you've done during the pandemic from your perspective? Let's take them in the order I introduced you. Lisa, would you like to start off?
Yes, I'm happy to start. The greatest takeaways from my perspective is the need to have a stable, well-functioning modeling team in-house, and to have a good context for that group to work in. And with a good context, I mean, there should be trust between the participants in that group. It should be reasonably big, not too few, not too many, say 5-6 people to be a functional group. And the group should have a good relationship with the management. So there is trust in the organization, and there is a freedom for the group to test new ideas. And it's so much easier in a crisis situation if those people know each other well beforehand. It is quite pivotal, I would say. And to have a common understanding of the topic they're working with, and preferably a common terminology to make the communication and the cooperation easier. So that is my takeaway, to have a stable, well-functioning group at place already in the beginning.
Excellent. Thank you, Lisa. Anders, what's your greatest takeaway?
My thoughts about that is quite different. I think it was nice to see how fast we could change, how fast we could work together, use other tools, and also how we during the pandemic has moved from telling the public about quite easy figures to now some journalists they ask me questions that I struggle to answer on the methodology level, and that's good. We have a brighter society.
Excellent. Thank you so much. Pauliina, what's your take on this?
Well, I kind of agree with both Lisa and Anders, but I would like to answer this from a broader context. And I was thinking like what we have learned as humans from this pandemic, and I think that we have learned some pretty crucial things. And one is that we have learned that we humans, when we face a global crisis, we have learned that we are able to unite and we are able to work in collaboration across the borders. However, unfortunately, we have also learned that when it comes to, for example, distribution of vaccines, let's just admit it, we rich countries have pretty much forgotten solidarity, and we have only cared about ourselves. And so kind of two things as humans and as nations, I think we have learned to be better prepared. We are kind of used to, at least in Nordic countries, that, you know, we have good times, no big crisis ahead, but we have learned that when it comes to critical things, we should be at least close to self-sufficient. We should have security storages of essential medical supplies. We should be prepared for shortages of imported goods, and we should have clear chain of command if we face some type of crisis. And I mean on national level and on communal level as well. And as individuals, I think that we have also learned to be more prepared, and we have learned to help each other.
Excellent. Thank you so much, Pauliina. Lasse?
It's a hard one to come after. I think I'll start agreeing with Lisa about having the existing relations prior to the pandemic. It's so important in order to make things work and to scale up fast. Also to get to communication going and so forth. But then you can say on a different perspective, I think the ability that we've been able to kind of change the behavior of the entire populations by communicating risk, communicating what to do. So I think at least in our countries that we represent, we have had less restrictions than some other places because we were able to kind of mitigate some of the challenges through communication. I think that adaptive population that we have, that has surprised me the most.
Excellent. Thank you so much. I should also say that we will open it up to questions afterwards. So if you have any questions listening in, you can either type them in the chat box or wait until we open up for questions and fire away then. But let's now keep this uninterrupted for now. Moving on, during the pandemic, a lot of countries chose different ways to collect their data and also to analyze it, which made it hard to make comparisons between countries. have we learned to be better at that during the pandemic, or is there a way to standardize collection and analysis going forward? Pauliina, would you like to kick it off?
Oh, that's a difficult one. I think that if I'm thinking about this really globally, we are really not able to unify data collection. But of course, we should follow, for example, recommendations of WHO. And there are excellent, like when I think we further, like later, talk more about, for example, European mortality monitoring project, etc., that are good in when we have to compare countries. But at least, I mean, of course, there are ways to standardize data collection, but before we have done that, before we are there, I think what is crucial is to communicate and alert other countries if we see anomalies, if we notice alarming trends, so that the other countries can be prepared.
Excellent. Anders?
I fully agree to the word communication, and that's between countries and also in countries. I think for me it has been we haven't managed to collaborate so good with the other Nordic countries, but we have been better inside Norway. My contact with the Norwegian Institute of Public Health are that's a different world, and we now divide the work in a much better way than we did before. We have some struggling in the start, and now it's super fine. And but we should in the start of the pandemic, we should be able to put our heads together and decide how do we do it in the Nordic countries, where we have mainly the same way to do things.
Lasse?
Thank you. I think, to be honest, in the beginning of the COVID pandemic, it was just taking all of us at a storm. We did not have the time to go into all those dialogues across countries and so on. We had enough on our plates just to provide the data that we needed to provide internally. Sort of along the lines of what you say, Anders. And then the further we progress, the more time there is to do this communication. So I think for me, that's the first part. I think to use a different case than COVID is the Mpox last summer, where there actually was a common case definition going across. And I think that's the first point. If you don't have a common case definition, you cannot share. Even within Denmark, how do you count a hospitalization? We have internally within SSI had two different definitions, with or because of COVID, but then the hospitals see it differently because they look into those that they have in isolation. So when we, even within the healthcare system, have different, you can say, interpretations of the same number, it's a challenge. So case definition, case definition, case definition. When we have that in place, we can move on.
All right, excellent. And Lisa, what's your take?
Well, I really can't see a realistic way of standardizing data collection. And also, as Lasse was pointing at, the interpretation of data includes taking the context into consideration as well, because there are so many different things in the countries that affect how you should interpret the data. And maybe we overestimate the need to compare countries. What is the goal of comparing countries when we know that data are collected in different ways? You have different age structure, family structures, organization of elderly care, urbanization level in the different countries, as well as testing capabilities, healthcare seeking behavior in the different countries. So maybe there are other needs, communication, cooperation between the countries, instead of standardizing data for comparison. So, well, that's my take on this.
Excellent. As you already introduced a bit, Pauliina, if we look to Europe, which is also partly under a similar umbrella with, for instance, Euromomo and other European efforts that were made to collect and sorry, Lasse, did you want to? No.
No, let's move on. I just have an add-on in that note.
Sorry. So yeah, there were a lot of European efforts made to collect and compare data in order to support countries really in Europe. Did that work, or do we need to maybe work even closer within the Nordic or Scandinavian countries to collaborate on these issues? Lasse, did you want to fire away?
I think there are many things here. First off, you say Euromomo is, you could say, living out of data that is being provided internally. The HERA is establishing a huge data platform within the EU HIP project. It's not there yet, but hopefully in place. But the idea is to have, you could say, some of these data shared. The question is how much can be shared and when. And the next question is who will have access to that data? Because you say, I think what we might be able to do in Nordic is to, well, we can share across if we have the right agreements in place beforehand. But the HERA platform, who is going to have access to it is going to be, for me, being a challenge. And I think that's the same for when you go into the detailed personal level data that you need for some of the analysis that you want to make. It's a challenge, and we need to have these things established up front. I hope that we can do it, within the Nordics. Last Friday, we heard from Susan Hopkins about how they did it in the UK, having, you say, established network of different teams working from different sites. And maybe we do not have critical mass within each of our countries to do a similar thing, but maybe we could do similar things across the Nordics.
That's a very interesting proposition. Anders, you want to? No, sorry. Yeah, Anders, do you want to?
Okay. Lasse filled my brain with a lot of thoughts. I think Nordic cooperation is much easier, and according to Euromomo or Normomo, I was in start. I was I thought it was strange seeing Norwegian death figures not coming from myself, and no one asking me about it, and it was also it was not easy communicating why are our figures so different, and why are also the figures from Eurostat different. That came later on in the pandemic, but it was very clear a year ago or something, and I got plenty of questions about it, and that made, as I said before, the contact with the Norwegian Institute of Public Health much better. We now have sorted things out, and we use mainly the same definitions.
Excellent. Lisa, do you want to?
Yeah, about the need for Nordic cooperation, closer cooperation, and sharing of data. For me in the modeling group, we didn't see an extra need for data sharing between the Nordic countries, because we had access to case data, etc. But what we needed, and what we used was sharing of experience between the modeling groups in the Nordic countries. What are the problems? What are you struggling with? So we started up monthly meetings with the modeling groups in the national authorities in the different Nordic countries, and kept those informal meetings all through the pandemic. And that was very helpful, but not by sharing the data, because as Lasse said earlier, we have the plate full of just taking care of our own situation in the country, not being able to add data from other countries into that picture as well. So relationship experiences, problems, solve problems together, but not the data sharing. It wasn't, from the modeling group, it wasn't necessary.
Right. Thank you. Interesting perspectives. Pauliina?
Well, maybe not sharing like individual level data, but the situation in Nordic countries would have been completely different unless we had gotten a warning from Central Europe. I mean, we saw what happened in other countries. We did receive excess death data. We did receive information about the number of hospitalizations. And because of that, we were not hit as hard as we would have been otherwise. So I think that I cannot emphasize more the importance of sharing information if it's not like really like a raw data, but like something is happening. And I think that European, for example, this European mortality monitoring project has a huge importance, because that is kind of, it was not put up because of COVID. It was existing already. It was more like put up to monitor whether we get like a unusually severe influenza season or something like that. So we are able to be prepared. And I think what is even more important, that they are modeling excess death, because COVID deaths were not registered in many places, at least at the early pandemic, because there was just no means of doing that, or no testings, etc. So I kind of slightly disagree that we are like self-sufficient and it's enough to look at our country, because we, if I'm thinking about it globally, knowing what happens in other countries is crucial if we want to prevent things getting extremely severe globally. So kind of great thanks to Central Europe.
Yeah, excellent. So, and you've touched on this before, that you really had your plates full, at least at the start of the pandemic. But a lot of countries also experienced a problem with having limited resources to allocate into data collection, analysis, but also other important tasks like treatments or subsidies to businesses and people that were suffering. How do you, from your perspective, look at allocating resources? What would be like top of mind? What's most important? Anders, would you like to start off?
Then it's what happened in Statistic Norway that I really know, and it was easy. It was easy to say this is important. We have a lot of questions. Yes, do what you think is good to do for answering the questions from abroad and from inside the country. I also think maybe the pain is now when we have to not use that much resources, but we still do. We still want to know more about what happened during the pandemic.
Lisa, would you care to?
Yes, and I understood your question as whether when the resources are limited, whether to put resources on collecting data when there are other burning issues. And I think prioritization of limited resources is always, of course, a question. And in the healthcare, I think there is a common view that treatment for the most severely ill must be prioritized, of course, and those at highest risk for becoming severely ill. So that must be a first-hand choice always. But I don't see really that those things are conflicting. Collection of data happens within the healthcare setting mainly. At least in the beginning, you get the data from testing, you get the data from hospitalizations, and those must be registered. Other data, on the other hand, like performing seropositivity studies in the population, they are very important, and they must be planned beforehand. And the importance of those kind of studies and point prevalence studies, they are very important, and maybe we should highlight the importance of performing such studies early in a pandemic and being better prepared. For the knowledge from such studies is very, very important for handling the pandemics and for hindering a bad development of the pandemic. So, of course, prioritization is difficult, but in the early stages, of course, care is always prioritized, but you should plan beforehand for population level studies.
Lasse?
Yes, I would say first and foremost, you could say in our model group, we said we're not going to politics. And this question is kind of borderline there. But I'll say that in reality, it's not about, you could say, money. The main limiting resource in many cases when you go into the pandemic state is manpower. And then you can say the traits that are used for patients, and that's a different trait than statisticians. And we are fairly inexpensive in relative terms. And I think that's important also there. But I also agree with Lisa's point about we need unbiased population studies somehow, because even though we tested a lot in Denmark, it's not unbiased. I mean, we had negative vaccine effectiveness estimates at points. I know why, but it's just some of these things that you need it to be unbiased. It's very difficult to get that throughout. And even if you try, you may not always get the participation that you wanted. So that's a challenge. So I think it's actually, when you go into the pandemic state, that is where the situation is different. The challenge is, as was said, the current more endemic state. How do you maintain, how do you prioritize what you want to keep doing? And there again is the treatment, that's the core. And then the question is, what is the most cost-effective way to get the information you need to follow? Because I think the biggest challenge when you just have the hospitalization is you're lacking the denominator. So right now, 50% of those that test positive in Denmark, I haven't done, but of the other 50% get hospitalized. So COVID is a very, very severe disease, right? But you lack something that is unbiased for the denominator. So I think that's the one thing to kind of keep in mind as well.
Pauliina?
I think that we are looking this like very much from Nordic perspectives now. So we are not really thinking about truly resource limited settings. I mean, there are people in this globe that do not have a birth certificate, and definitely not all deaths are registered, and I'm not even going to talk about the cause of death being registered correctly. So I think where this is important when we look at it globally, and when we are truly in resource limited settings and there is some outbreak, like I'm talking about, for example, early pandemic, and without knowledge we don't know how to allocate resources, and I'm talking about this globally. I think that this type of questions are such that I have discussed more with my collaborators, for example, from Uganda, from Entebbe Virus Research Institute, and then like without data you cannot allocate resources. Without predictions you don't know like how to efficiently organize things, and we are in a good position here in Nordic countries, but I think we should kind of acknowledge that globally it's not always so, and I'm again emphasizing the role of WHO and its funding. It also protects us.
Excellent. Something that you've also touched on, all of you, is the communication. How should we go about communicating our findings to make it as clear and comparable as possible? Pauliina, would you like to start off this question?
Oh, this is difficult. I mean, when we are talking with experts, I think we all know the jazz. I mean, if something is unclear, we can ask. If it's not clear to us how something was modeled, you know, let's just look at the publication. It's explained there, or we can contact the expert who was doing the study. We can ask how the data was collected. But then when it comes to communicating findings clearly to a general public, that is much more difficult. And I think we should, for example, remember to avoid difficult terminology. And sometimes we try, but we fail, because some terminology that is difficult for general public is so everyday language to us that we really try to avoid, but we fail. And I think we should carefully listen to general public, and again and again and again try to answer and try to hear the worries and answer the questions as well as we can. And also we can sometimes say that we don't know, but based on our knowledge it seems like, but there's a great uncertainty, etc. Being honest, trying to avoid difficult language when with general public, I would say.
Excellent, thank you. Lisa, what is your take on communication?
Unfortunately, I don't have a simple or complicated answer to this, since it's not my area of expertise. And I think that's maybe that's my take on it. We need professional communicators to help us in this area, to help us formulating the messages and the explanation so that they are understandable for a broader public. Maybe sometimes skip explaining things that are too complicated. We don't always need to explain all details to everyone. The scientific mistakes sometimes prevail in our publications, that we try to explain everything, but they are of no help always. Maybe they can be published as a complementary information. Of course, as Pauliina says, trying to be honest, trying to be transparent always, publishing source code, publishing data, sharing those, trying always to be transparent, and taking the audience and the public seriously, and all the questions seriously. But we need help. It's not our profession, and we need professional help from communicators, I would say.
Excellent, thank you. Lasse, what's your thought on communication?
I would say yes. You have to first think of whom are you communicating to. Most of what we've been writing has been to the ministry and indirectly to the politicians. They're going to make decisions about what to do, what not to do, and that's a very difficult group to write to. They have very different mixed backgrounds, but they also have, you could say, different agendas. I think that's fair to put it that way without putting too much emphasis into that. But it means that when you communicate uncertainty, and I think it's important that we do so, and we keep doing that, and also saying the structural uncertainty that is on top of the model uncertainty and so forth. So I think it's important that we stick to a terminology that can be read by others. We had a quite interdisciplinary group, so that was a great help that we're not just modelers, but also had some doctors and some others that could help rewriting things so that it was understandable, and then long appendices with details for those that cared. But it is definitely a challenge. But I also think it's crucial that you put up those assumptions that you have used and make that up in the main part, because that's what you need to cover your back afterwards. We've been there a couple of times, and I've been quite happy about some of the things that have been added in the description up front. So I think that's actually one of the learnings when you communicate to non-scientists. These, you can say, discussion points, it's not just hidden somewhere. It should be up front.
Excellent, thank you. Anders?
Like I said before, I think we have a better general public now, because they have been used to words like backlog and excess mortality and life expectancy, and now it has been more clear for them what it means, because so many has asked the questions. What does it really say? Why is it different in the Nordic countries, or maybe why is it the same in Sweden and Norway? Though we didn't handle the pandemic exactly the same way. So, but that's also as a communication for me in statistics Norway. It's difficult, and it's not the best part of my work, because I'm limited to say only what my figure says, not my thoughts about it. And also the pandemic has been quite interesting to see, because so many predictions has failed. So if we go back to spring 2020 and see the predictions in my colleagues and in the public, so many of them has failed.
And that gives an excellent prompt to my next question. Given this inherent uncertainty in an event like a pandemic, should we say no to providing certain forecasts or scenarios or predictions? Anders, would you like to keep on?
Yes, because that's what I'm used to. My first interview in television was not about deaths. It was about it was about the marriage and divorces, and many said, oh, they will divorce from each other because they will live too tight. And I said, no one knows. I don't know, but I'm certain and that we will have fewer marriages the next year, and that was easy. But that's the limit I have. I didn't know. No one said that we would have a increase in births. No one, absolutely no one in Norway predicted that. So yeah, okay.
Thank you. Pauliina?
I'm pretty sure we have all said no several times at least. I think whether to say no or not, I think we should still remember that policy makers, decision makers, they really need these scenarios and predictions, and often even uncertain predictions or scenarios are much better than pure guessing. And but naturally, of course, we always have to discuss uncertainties. Uncertainties related to modeling, uncertainties related to data, and emphasize that, you know, when we are doing some predictions, even if the model is correct, even if we have beautiful data, if the behavior of individuals change, then the outcome changes as well. It's not deterministic, and often that is why we are making these predictions or scenarios to see, you know, that does it seem like the outcome will be disastrous if we keep on doing what we are doing. And if it is like that, we have an opportunity to act. And sometimes it's good just to communicate that also to general public. Like if we keep on doing like that, it seems that there are more and more patients coming into hospitals and they are very burdened. So try to avoid contacts, etc. And then, you know, when numbers go down, and the predictions are not correct, it's often also the matter of conditions. It's a matter of conditions that have changed in a good way, and I think communicating that is extremely difficult. That, you know, if we have restrictions, yeah, that changes the outcome. That is why we have these restrictions, for example, and communicating that is super difficult. And honestly, I think that every single prediction that I made at the early pandemic, every single prediction that I have seen others doing at the early pandemic failed. We did not have enough information, so I definitely agree, but I still think that there was a place for those, because those helped policy making. Those helped also general public to be better prepared.
Excellent. Lasse, what's your take on, should we say no?
I think I will pick up where Pauliina ended, to say all models are wrong, but some are useful. I cannot say that too many times, I think. And I agree that you say a lot of, you can say, the scenarios that we've been doing, we do not want to see that, you can say, in real life. But that's when you see the adaptive behavior, and we have made modeling everything else given. But that's not about no. That's a different thing. That's about, you can say, adaptive behavior. We have said no a number of times, but I think even more times we have had the dialogue about how do you rephrase the question to something that is meaningful to model. And I think that's where I want to go first. One of the places where we have said a definite no, that is when asked, could we have people coming back into the stadiums to watch football games, handball, and so on, and they can section it, they can do everything within the stadium, but they cannot control what happens outside. So given the fact that you can control one part, but you cannot control the major part of the mingling between people, we said, well, it doesn't make sense to do that, because the risk there, you can, yes, but, and if that but is too big, you should have that discussion and say no. Just to come with one example.
Excellent. Final comment, Lisa, what's your take on saying no?
For a group of modelers, it could be they are maybe very eager to start producing their own models very, very early, and that is a risk. because, there's always better producing something than nothing for the politicians, not having to guess. But we have to be responsible and actively work to minimize the amount of uncertainty and make a trade-off between how big the uncertainty may be and the need for information. So if the uncertainty is huge and the implication of producing maybe very erroneous scenarios is big, maybe then it's our responsibility to say, no, at this stage, we cannot produce anything that we deem is helpful for you. So we said no in the very early stages, and we said no to producing dynamic scenarios because it was too much uncertainty about how large fraction of all cases are actually recognized, tested, and is there another large fraction? How large is the fraction who we don't know about? And that affects, of course, the dynamics. So what we did instead, use available data at an early stage. So we can minimize the amount of uncertainty and very explicitly just using available data from Wuhan in our case. So we did it in the spring 2020 and produced what we call realistic worst case scenario, kind of based on the population size in the city of Wuhan, transferring that to the region and changing for age structure and underlying morbidity, etc., to say, okay, this is what you in the healthcare sector can prepare for in a worst case scenario, given to our best understanding in discussion with medical doctors, etc. And very recently, we just reviewed those scenarios, and they were very good. The scenarios showed the double maximum amount of hospitalized bed than what happened in reality. So I would say, yes, they were very helpful because we didn't dare to start producing our own dynamic simulation models at that stage. So we should say no sometimes, but instead see what is helpful and what data do we have.
Excellent. Very, very interesting. Thank you, all of you. Let's open it up to questions from the auditorium. And as I said, feel free to type in the chat. I will start off with one question that has come in. It says, maybe the important part of data coordination is to be able to make models that include several countries, such that disease movement across borders can be understood better. For instance, a wave coming from Southern Europe might hit Denmark first, so Norway would want to know when they can expect it to hit them. Well, it seems we'll start off with, Denmark and Norway. I was going to say, Lasse, please go.
Thank you. I think it's important, I think it was Pauliina saying, what is important to communicate is cases, is the accurate numbers, it's not the person level data. So you have to know, have to be able to communicate and talk to what is the situation, what to expect, more than, you could say, having models. You could say, and if you look at movement across borders, yes, it's an interesting question. Effectively, it matters in the very, very early stages of spread, but later on, it really is such a small component in most cases. So there is a window of a few weeks where it could have made a difference, in my view. The important thing is to communicating, and I would say we got everything through the media initially from Bergamo and around there. That was like, we don't want to go there. That was the signal we got, and that was heard.
Who wants to pick it up? Anders, Pauliina, Lisa? Anders, go.
I had that. It was strange in Norway. Norway is a bit longer, a bit bigger than Denmark, and I was traveling in Norway a couple of times during the pandemic, and when this was semi lockdown, and it was like being in different countries. In the south, it was quite harsh, and you had to stay at home. And when you came north of Trondheim, pandemic, it's what is that? Why don't we hug anymore? And further north, they said, oh, this 2 meter distance. We long to come back to the 3 meters. That's normal here. That's not very serious, but it was big. It was big differences in Norway, and we learned from other countries. Yes.
Pauliina, would you like to comment?
Well, I think that we did learn from other countries, and when it comes to raw data, there are so many issues to be solved before you can really use raw data in modeling. But also what Lisa said about using knowledge from other countries in modeling, that we can of course do, but I think that the most important thing is to communicate so that we know if something's going on, and not just this pandemic, but in the future as well.
Lisa, do you have any comments on?
I think this goes back to my last message, that the amount of uncertainty must be taken into this trade-off. And if you include several countries with different structure, different measuring of data, etc., the amount of uncertainty increases very much. So the added value, as Lasse said, mainly valid in the first few weeks of a pandemic. So I don't know if it's really realistic and helpful, given the effort it would take to create such multi-country models to be effectively helpful.
All right. We thank you, Adam Mjelke, for that question. We have another one that might be a political powder keg. In hindsight, what country or countries had the best policy regarding pandemic restrictions? Now, please be civil. Lisa, would you like to take it off?
No, I think it's not my question to answer, and I don't think it's anybody's really question to answer, because it depends on so many things, and it's not a competition. I mean, all countries are doing the best they can. So no, I pass on this. Thank you.
Thank you. Anders, would you like to comment?
Oh, you asked me before, should we say no at any time? This is my time.
Excellent. Thank you. Lasse, Pauliina,
I think I'll just echo Anders. I mean, you can always do what if scenarios, but you could say, if there's one thing that one would want to change, is maybe when do you close schools and reconsider how can you do about schools. I think that's a fair thing to open, where Sweden has been more open than we have been, and that's maybe one place where we could have done better. But the optimal scenario, I'm not going to state in that.
Pauliina?
I would say that best policies depend on the structure of the population, the population density, the healthcare systems, not just like a level of healthcare system, but how is it how it is organized. And I do have favorite countries, and I definitely will not reveal to anybody. That's like too hot potato, let's say. But I think this is as the others have stated, this is not our place to say.
Excellent, thank you.
Like private Pauliina has an opinion, but Professor Pauliina does not have.
Well, let's stick with the professional. Another question. We've seen very advanced modeling on national data that is a mixture of data from a very different local community. How did you handle that issue? Anyone wants to take this? Lasse?
I can say Denmark is a fairly small country, so it's not a huge challenge here compared to, you could say, some of the others here. But even in Denmark, we see that there are regional differences, and we did estimate parameters for each of the regions. And we started doing that in the summer of 2020. I think it was in June that we split up. No, May that we split up in regions, because we saw the need to do so, even in Denmark.
Excellent. Who else? Lisa, would you like to comment on this?
Well, it was the same. We tried to make separate simulations, like separate populations for each of the 21 regions in Sweden in the beginning. It was very time consuming, and it looked very different in the different regions. After a while, the differences weren't that big anymore. But it was very challenging, yes.
Pauliina, did you experience similar?
Well, yes, in Finland also there were modeling done separately for different regions, and actually because of that, the big region, Uusimaa region, was separated from the rest of the Finland, because here in Uusimaa region, where like the Helsinki and the surroundings belong to, we had much like more severe situation as in the rest of the country. I think that the decision was correct then, back then, that Uusimaa was separated from the rest of the country, and stricter rules in Uusimaa region. On personal level, it was of course very difficult, because my elementary school age son lives outside of Uusimaa region. I live in Uusimaa region, so I did not see my son for several weeks, and I still thought that it was the correct decision back then. Based on the knowledge we had then, it's very easy to be smart afterwards, but based on the knowledge we had, it was the correct decision.
Anders? Anything to add?
It's kind of more of what I said last time. We had great discussions about should it be all nations or the same rules for the whole nation, or should we do something different? We did mainly have the same rules, but we didn't do it the same way, I think. And it was hard to do the good communication about it. Yeah.
We have 2 more questions that are come in. We have 2 minutes left, so let's make this super short answers for the final 2 questions. There were much more collaboration between academia and public health agencies in other countries, for instance, the UK. How can this be improved next time? And do we want this? Relevant question. Pauliina, would you like to start off?
I think we had collaboration between academia and other, let's say, institutions and policy makers, etc. It's just that not everything is done in public. And I think there were good discussions and good collaboration. So I don't think that we did not have that. So kind of hard to answer. I think collaboration is good. Collaboration within countries, collaboration between countries, collaboration globally. Yay.
Okay, thank you. Lisa, would you like to take it? I see you, Lasse. I'll get to you in a while.
I mean, very shortly, of course, we had quite much communication with Tom based on personal relationships. but no formal collaboration, and maybe because it's different time scales in the public health agencies and the academy, and simply there was no time to establish formal collaborations at that time. In the future, maybe prepare those in peacetime instead, so they are ready when it becomes a crisis.
Excellent. Lasse?
That was very close to what I wanted to say. We established a lot of that, but the UK had the benefit of having that established up front. The question is, how do we finance that? I think because being in academia, I have a background there. You need the financing. So do we in the public health agencies. So there needs to be awareness. How I see it is that it provides a very much larger knowledge base for doing research and answering questions when something happens. But we need to know each other up front to make it even better.
Excellent. I'll let Anders answer, and then back to you, Pauliina. Anders? Very quick.
I think this is what we do now is a good example of what we've learned, and that's much more cost efficient than the way we did it before, and we have better contact now than before. So
thank you, Pauliina.
And actually in Finland we did put up so-called datahuone, data room, that is kind of there are several people involved. Some are from academia, some are from, for example, Statistics Finland, etc. Close connection to policymakers, and the purpose of the data room is to, if there's like an urgent need to get answers, analyze some data, to get answers for the policymakers in a hurry, then a data room reacts. So that is something that is kind of new in Finland, that brings together people from Statistics Finland, people from academia, and national level decision makers.
Excellent. Thank you so much. We've already overshot by 2 minutes, so we're not going to go into the final question. We do have a responsibility to you and also to all our listeners as well. So thank you very, very much. This was super interesting. I have learned so much, and I really hope that we can have a lot more collaboration before upcoming pandemics, and also during those that are to come. So big thank you to Lisa, Anders, Pauliina, and Lasse for joining us today.